Hi, I'm Megan Mattingly, and I'm a distant student for HAS905. My research focused on the secondary analysis of social support in people ageing with HIV in South Africa. My research was supervised by Dr. Catherine McPhail. The support keeps me strong, a qualitative study into the social support of older people with HIV in South Africa. South Africa, unlike other countries in sub-Saharan Africa, is amidst a human immunodeficiency virus, HIV, epidemic, accounting for 34% of the global HIV prevalence. Health implications associated with aging with HIV include negative outcomes and comorbidities, slower rates of antiretroviral ART responses, swift disease progression, and reduced life expectancy. Of those living with HIV, 7.6% were aged over 50, therefore classified to be aging with HIV. Of those living and aging with HIV in South Africa, approximately half had regular and consistent access to ART treatments. ART treatments are becoming more effective in managing the deceleration of HIV progression, therefore advancement to AIDS or death, but have only recently become more available to the wider South African population. Therefore, aging with HIV is a relatively new phenomenon, as it was not possible without the effective treatments. Traditionally, it was believed older adults were more likely to be affected rather than infected when considering HIV. Therefore, the aim of this qualitative study is to understand the provision of social support to and by South African older adults aged 50 years and over who are aging with HIV, and how it differs depending on the social context such as sex and relationship status. A secondary of the aim included publishing the paper to AIDS and Behaviours. The primary data was collected in the form of semi-structured interviews in 2014 at an urban HIV treatment clinic in Johannesburg. More information is available in my final submission. As I completed a secondary analysis, my main focus was both on content and thematic analysis using in vivo. The analysis was done through several key steps, such as familiarization, synthesis, and interpretation. The transcripts were familiarized by reading through several times before progressing. Nodes were developed using the interview guide under themes of well-being, caregiving and receiving, HIV care, and sexual well-being. Nodes were also developed from recurring and otherwise identified themes whilst reading the transcripts. A total of 189 nodes were formed across 34 main themes. Finally, the data was analysed and interpreted to determine key themes, differences and similarities of experiences associated with aging with HIV. The main form of dependency was financial support of children, occurring through the provision of school fees, university costs, housing and food. Of the 7 male participants, only one commented on his role of emotional dependency of his children. He was also a sole provider and widower. Females had a larger variety of dependents, including children, grandchildren, parents, siblings, and in-laws. Whilst there was limited information on what type of support they provide, those who commented mentioned domestic duties, financial support, shopping, and emotional support. All participants identified strong network from their children. The support ranged from domestic and practical support, such as transport, as well as reminders to take medications. Support from children often came immediately after disclosing their HIV status, whether this was as soon as the individual was diagnosed or later on. Significant others, partners and family members other than children played a crucial role in providing support to participants aging with HIV. Partner support is an important aspect of aging for men in South Africa, as they rely heavily on their partner for caregiving and support. The support range from cooking, cleaning, ironing to talking, as well as the possibility of continued support through sickness. It is recommended that future studies into the experiences of ageing with HIV and how the processes and experiences differ are conducted.